Do you want to talk about something that's kind of controversial specifically in the digestive health poop world? That is how regular you should be. So it is technically normal by the societal governing bodies of GI that you can poop 3 times a week. And that's considered normal. Anything less than that would be considered constipation. However, in our IBS world, so I'm not thinking general healthy population, in the IBS world, especially my patients with IBS constipation or even chronic constipation, I rarely see a patient or a client of mine feel good pooping less than once a day for most days. So I usually will recommend, as a registered dietitian in this space, that we aim for and we make it a goal to get to that once a day at least bowel movement, and try to aim for 1 to 3 bowel movements a day, which is considered normal as well. Up to 3 is considered normal. But before we get crazy with the controversies, right? Before a conversation and some fights break out, what is normal? What does that even mean? And how can you figure out what your normal should be with how much you poop? It comes down to your other symptoms and the volume of poop that you are releasing. So first let's talk about your volume, and then we'll talk about other symptoms. I rarely will only use what's called the Bristol stool chart, or looking at the form of your stool, the form of your poop, when I'm evaluating one of my clients to understand their symptoms. The reason why is that you've probably seen that chart before. If not, pause the video, go Google Bristol stool chart. Whenever we're at the 1, it's little tiny circle pebbles, right? The harder your poop is, the less like a smooth log it is. If it's really hard, clumpy, you might be constipated. If it's really loose and close to liquid, you may have diarrhea. That is not always true, and that doesn't give us a full picture. A lot of clients that come into my practice may have a type 4, perfect log, smooth poop, but whenever we evaluate how much poop they're actually letting out every few days or every other day or even once a day, if they're only releasing a small amount of poop with little tiny logs in the toilet bowl, they could still be constipated and backed up, which is where the other symptoms come in. If they're releasing good form stool, but they have a lot of urgency and they're releasing so much volume where they're clogging the toilet, that's not normal. That's a problem, right? And so we have to evaluate the volume. That will also tell us what your normal frequency of the week would be, because if you're going every other day but you have a great volume of release, awesome. Then we have to look at other symptoms. So how do you actually feel? If you're pooping every other day and you feel amazing, great. If you don't, and you're bloated and you're gassy and you're sluggish, maybe it's not normal, right?